Welcome to this presentation. In this presentation, let us have an insight of shortwave diathermy. What is shortwave diathermy? Ultrasound therapy machines are popular modality that uses sound waves to reduce the pain and swelling of soft tissue injuries. This modality is used by practitioners like physical therapists to treat small and specific injury sites. Shortwave diathermy is typically used as an alternative to ultrasound when a wider area of heat application is required. We know that diathermy is a therapeutic modality that is most commonly used for joint conditions such as arthritis, and then the diathermy refers to the creation of heat using electrical pulses. In diathermy, high frequency electric current is delivered via shortwave, microwave, or ultrasound, which is able to generate deep heat in body tissues. The heat can be used to improve circulation and to relieve pain. In addition, shortwave diathermy can be used in medicine for treating damaged tissues and relaxing muscles. The electrical pulse of shortwave diathermy creates heat deep inside a targeted tissue, reaching areas as deep as 2 inches from the skin surface. While the diathermy machine doesn't apply heat directly into the body, the current created by the machine allows the body to generate heat within the targeted area itself. So it is when the heat of the area increases that blood flow is improved, along with improvements in flexibility and stiff joints and connective tissue, making it a good choice to use for patients with arthritis. The main benefits for decreased pain and inflammation is it allows patients to gently increase their range of motion, allowing them to move with more ease and participate in rehabilitation with more comfort. Diathermy is not just used in rehabilitation. Diathermy can be used in surgical procedures where when the electrode can be applied to a blood vessel. The heat generated by the diathermy in the vessel will cause the blood to coagulate, allowing the vessel to seal. And the diathermy can also be used to remove abnormal growths such as tumors, especially in the procedures where traditional techniques are impractical. For example, surgical diathermy can be used to address issues in the prostate and bladder, cervix, brain, ovaries, balls, eyes, and tonsils. Now let us see how does that shortwave diathermy work. Shortwave diathermy is a distinguished form of diathermy that is different than ultrasound and microwave, which involves sending high frequency waves throughout the patient's body and into the affected tissues. The energy waves are sent from condenser plates located on either side of the tissue being treated. Typical shortwave diathermy machines operate at a frequency of 27.33 MHz and have a wavelength of 11 meters. Similar to other methods for applying energy to the body, shortwave diathermy can be applied in two distinct modes, that is continuous and pulsed mode. When continuous mode is used, the tissue being targeted becomes heated as the waves constantly convey energy to them. Pulsed mode is used when less heat is desired for the affected tissue. When shortwave diathermy is applied in pulse mode, the mechanical effects of the treatment are applied independent of the thermally affecting tissue. One of the most promising applications of pulsed mode is it's able to facilitate increased flexibility and joint mobilization for restoration of joint range of motion. Shortwave diathermy includes non-thermal benefits as well, including acceleration of cell growth, enabling damaged cells to return to normal functions, increased wound healing, and shortwave diathermy is also effective when used with other rehabilitative modalities. So, in a study published in the American Journal of Physical Medicine and Rehabilitation found that the shortwave diathermy used in the heart packs and exercises were more effective in reducing pain and increasing function in participants with knee also. And another study shows that shortwave diathermy significantly decreased pain, improved circulation, and increased flexibility in patients with low back pain. Shortwave diathermy is used for over metal implants that have circular wire components of elements that forms loops or circles, because it may result in excessive heating of the metal, causing the discomfort or possible injury. And some possible conditions that can be treated by the shortwave diathermy are arthritis, back pain, muscle spasms, and sprains and strains, and dentitis and bone injuries, and so on. And this diagram shows the block diagram of a shortwave diathermy. And the circuit of a typical shortwave diathermy consists of two transformers and a tube and a tuning indicator. The transformer T1 provides the EHT2 anode and heating current to the cathode. The anode is driven at 4000 volts and an LC-tuned circuit formed by the coil AB along with the capacitor C1 is used to generate the short wave of the desired frequency. The coil CD generates the positive feedback for the oscillations to occur. The coil EF along with the capacitor C2 forms the patient tuning circuit for coupling, and the intensity of current applied to the patient can be controlled by controlling the anode voltage, controlling the filament heating current, and controlling the grid bias. The intensity of the current applied to the patient is shown as on a meter, and up to 500 watts of electrical energy is available from the circuit. Then auto-tuning means, that is, for example, when maximum electrical energy is delivered to the patient only if the unit is correctly tuned to the electrical values of the object. Detuning may happen due to unavoidable and involuntary movements of the patient. An electronic circuit is used to measure the polarity and magnitude of the detuning and to adjust the tuning of the capacitor accordingly. The current through the patient is used to charge a capacitor to a voltage, which is a measure of the detuning. This voltage operates as a servomotor to adjust the tuning capacitor accordingly. Now let us see the applications of short wave diathermy. The first type is condenser type. The output of the short wave diathermy machine is connected to a metal electrode which are positioned on the body over the region to be treated. These electrodes are called pads in the terminology of the diathermy. The part of the body to be treated is placed between the electrodes and called the pads without touching the skin. This forms the capacitor. Due to dielectric loss, heat is produced in the intervening tissues, and this diagram shows how the coil is wound over the body to form this short wave diathermy. Usually layers of towels are interposed between the metal and the surface of the body, and the pads are placed so that the portion of the body to be treated is sandwiched between them. This arrangement is called the condenser method, wherein the metal pads acts as two plates while the body tissues between the pads is dielectric of the capacitor. And the radio frequency output is applied to the pads. The dielectric losses of the capacitor manifest themselves as heat in the intervening tissues. And short wave diathermy is a modality that produces heat by converting the electromagnetic energy into thermal energy. And continuous short wave diathermy is a technique of choice when uniform elevation of temperature is required in deep tissues and inside joints. And the acute lesions are better treated with the pulsed short wave diathermy. Continuous short wave diathermy, when applied properly, is believed to have the ability to relieve the pain and muscle spasm, resolve inflammation and reduce swelling, and increase the soft tissue extensibility and joint range of movement. Short wave diathermy utilizes the electromagnetic radio waves to convert the energy into deep heat. As with the ultrasound, short wave diathermy is thought to exert its therapeutic effects by both thermal and non-thermal mechanisms. The primary non-thermal mechanism associated with the use of the therapeutic short wave diathermy occurs via vibration induction of tissue molecules when exposed to radio waves. By changing the characteristics of short wave applicator, the clinician can target the specific type of tissue he or she wants to heat. By using an inductive applicator that generates magnetically induced eddy or radio wave currents in the tissue, selective heating of water-rich tissues such as muscle can be obtained. So by using the capacity coupled applicator that generates heat via generation of electric field, selective heating of waterproof tissues such as fat and adjacent soft tissues can be accomplished. With either type of short wave diathermy, metal must be avoided so that the patient must remove all jewelry, and treatment must be carried out in a non-conductive treatment table such as one made of wood. So furthermore, the implanted pacemaker, spinal cord stimulators, surgical implants, and copper containing IODs should never be exposed to short wave diathermy to avoid excessive heating and thermal injury. And the second method is inductor method. A flexible cable is wound around the part of the body to be treated. Here, when a RF current is passed through the cable, an electric current is set up at its ends and the magnetic field at the center. Deep heating is achieved via the electrostatic field and superficial heating is achieved via magnetic field. And this diagram shows how the inductor method is carried out in a short wave diathermy unit. So indications for short wave diathermy mirror are those listed for ultrasound, although the ability to heat the fat and adjacent soft tissues not reached by superficial heat modalities unless well heated by ultrasound may lead to the clinician to choose short wave diathermy to treat painful conditions and other pathologic processes that are thought to find their needed in very more superficial tissues. And short-wave diathermy is another deep heating thermal modality, and it is probably the best thermal modality available to the practitioner. It is also a modality about which the many practitioners have significant reservations, some of which are well-founded and others are not. Short-wave diathermy uses short waves of 10 to 100 megahertz and electromagnetic energy to cause the increase in tissue temperature. To avoid radio frequency interference with communication frequencies, the Federal Communication Commission regulates the frequency of its short-wave diathermy available and has allocated 3 frequencies for medical use, that is 13.56, 27.12 and 40.68 megahertz. Thank you.